Hello everyone, this is Mila. Today I'm reading chapter 15, Chronic Fatigue and Fibromyalgia. I'm just so tired all the time. It is difficult for me to concentrate. I can't remember the last time I felt good. In fact, I'm having a hard time remembering a lot of things. I know something is wrong with me. I don't have any energy, and I seem to catch every bug that comes along. I need help, but I don't know where to start. Maybe it's my thyroid, and my family has a history of thyroid problems. Have you ever uttered this statement? I can't tell you the number of patients who consult my webpage seeking help or come into my office with this kind of complaints. They are frustrated and discouraged with their ongoing condition. In the 30 years I've been in private practice, I have to say that these are some of the most common ailments I heard about. During a consult visit, doctors usually ask, "Do you hurt anywhere? Do you have any other symptoms?" Then we run through a complete review of potential complaints, try to find out if the patient is suffering from symptoms ranging from headaches to chest discomfort to diarrhea. Often, patients answer in the negative to all of these specific questions on site. I'm just really tired and have absolutely no energy. When physicians comfort the situation, they usually recommend a completely physical exam with comprehensive chemistry profile. On the next visit, the physician will go over the patient's complaints again and review past, present, and family health histories. He will conduct another physical exam, and after the evaluation is complete, the doctor will carefully review the laboratory data. Occasionally, he discovers evidence of hypostasis, diabetics, anemia, or some other disease process that is causing this symptom of fatigue. But the overwhelming majority of the time, he found nothing but sufficient exam by the patient is feeling so tired and worn out. At this point, most physicians begin questioning the patient about possible signs of increased stress or symptom of depression. If this lining of question doesn't reveal any apparent explanation, tension begins to fill the air. The patients start to realize the doctor is not finding anything wrong. The doctor may have insinuated that the problem is all in the patient's head. Of course, this is not a verbal exchange, but the unspoken reality is most certainly communicated through abstract tones and body language. If you have ever been in this situation like this, you understand fully what I'm talking about. What just happened? Physicians want to help their patient, and most often they feel the only way to accomplish this task is by finding a disease process and begin treatment with a prescription. When they can't find anything wrong or can't write a prescription, doctors become uncomfortable with the mounting pressure to provide an explanation of course of action to make the patient feel better. A doctor may dismiss the visit by standing up and saying, "Well, you are really in excellent health. I can't find anything, but would explain your symptom. Just give me some time and see if you feel better." If you have experienced something similar, you know you have nothing else to do but turn and leave the doctor's office, frustrated. You had already given it plenty of time before you went to see the doctor in the first place. Beyond doubt, you are not well. And now that the doctor can't find anything wrong, even you begin to wonder if it's true or psychosomatic. But the frustration is only beginning. You may determine to follow your physician's advice and give yourself more time while to do everything in your power to take better care of yourself. Instead of getting better, thus you either don't improve or even get worse. Where do you go from there? Do you get a second option? If you do see another medical doctor, chances are good that he will not find anything wrong either. Anxious and disappointed with the healthcare system begin to speak. On the one hand, you are happy that no one has found anything seriously. But on the other hand, you are angry because no one has answers. In fact, you begin to feel any annoyance and are intimidated about going back. This is when a close friend or family member told you about alternative healthcare practitioner who was really able to help him with the same problem. Alternative healthcare. Your journey continues as you turn from the medical community in search of a solution. You decide to seek out a more natural route. Alternative healthcare, because traditional medicine has been no help, to the contract, it probably made you feel worse. To your surprise, the alternative healthcare provider identify a problem right away. He may claim that you have symptoms yeast, leaky gut syndrome, or subclinical hypothyroidism as the cause of your symptoms. Alternative practitioners typically do a hair or eye analysis, blood work, urinary tests, or muscle exam to determine exactly what you need. Then, they usually recommend certain herbs, bowel cleanse, diet change, and nutritional supplement to correct diagnosis problem. Relief and hope months because someone is finally listening and can actually provide an explanation for the acceleration. Even if the diagnosis is not entirely correct, even though your health and your sense of well-being may improve because of lifestyle change. You may begin to realize you should be feeling better and are still not yourself. Here's why. Alternative care practitioner focus on trying to find out exactly which nutritional deficiency you may have and then try to correct them. But they are not correcting the underlying problem, which is the oxidative stress. Most likely, you will remain frustrated and have continue reading and doing not anything and you can to find help. You may allergical depressed. Have you ever been sick and tired of being sick and tired? Many people with fatigue level their doctor's office with prescription of antidepressants. When the physician is not able to find anything wrong, he assumes that patient is depressed. But I have learned that when patients do not feel well and do not have the energy to perform their duty, they get discouraged and second-guessing themselves. They wonder if they will ever have the energy to be high spirits again. As time wears out, they do get down, they become depressed. But this is truly different from depression you see in a patient who is emotional depressed. This is why I label this patient immunological depressed. The increased oxidative stress people experience not only create fatigue, but also deplete the immune system. When patients use nutritional supplements to bring oxidative stress back under control, they not only feel better, but they begin to function normally again, which makes them feel better still. I always enjoy when my patients tell me during a return visit. I'm not depressed anymore. Can I go off the antidepressant the other doctor prescribed? They never really helped me anyway. The very serious illness in this book that I have discussed are merely the end results of prolonged exposure to excessive oxidative stress within the body. People do not realize that lasting fatigue is the same continually and severely illness. So many will not develop a serious illness initially. When their body are under attack of prolonged oxidative stress, they will continue to wear down until a serious disease develop. If I were to do a study of people passing by on the sidewalk to determine how many don't feel up to bar, have significant amounts of residual fatigue, my guess is the numbers will be shocking. Let me tell you what I have learned over the past 7 years of practicing nutritional supplements medicine. You don't just wake up one morning with chronic fatigue syndrome or fibromyalgia. My patients who are coming in not feeling well, complaining of fatigue, frequency infection, poor sleep, anxious, depression are also suffering from the beginning stage of degenerative due to the increased oxidative stress. I can almost tell by look at a person's face he's under excessive oxidative stress. His face is drawn and ash color. He does not look vibrant and healthy. If we don't address the underlying problem effectively, this patient will most likely develop chronic fatigue, fibromyalgia, and even more serious degenerative disease. I no longer send my worn patient out the door with the comment, "I can't find anything wrong with you." I know this causes immunology, depression, and may lead to more serious condition. I now encourage people to look at their lifestyle and environments for possible clue of increased stress or toxin exposure. They needed to attempt to eliminate cause of increased oxidative stress. See Chapter 3, as much as is humanly possible. It is important for them to think about their lifestyle and their stress level, as they're being exposed to excessive toxins like secondary cigarette smoke, herbicide, pesticide, and airborne pollutants. I encourage them to get proper rest, to start exercise regularly, and begin to eat a healthy diet. I then start them on patent antioxidant tablets, mineral tablet, and some group C extract. Have them return to see me in clinical in about 4 to 6 weeks. Unless alternative practitioner, I look for the root cause of the symptoms. I don't need to do the expensive testing they do. Most has been shown to be inaccurate anyway, because I'm not trying to correct any one particular nutritional deficiency. But rather than the underlying traits of oxidative stress, instead, I attempt to provide the cell with all of the micronutrients at the optimal level. The cell will decide what does and what does not need. Consistently with the medical literature, I found that bring oxidative stress back under control with cellular nutrition is by far the most effective meaning of redundant one's health. With this approach, the overwhelming majority of patients are able to return to normal life. Follow-up is also very important. It is simple, amazing to see how many patients return and feeling almost normal again. Their improvements are often dramatically, obviously in their face and skin tone, and to think for years I used to just send this patient out the door with no hope and no counselor. The right treatment was there all along. a study of chronic fatigue and fibromyalgia. Judy's experience with fibromyalgia began in November of 1990. She had been a person who was seldom sick, but that year she became very ill with flu-like symptoms that caused her body to itch so severely that she thought at any moment she would have to rush to the emergency room. It took almost 2 weeks before she recovered fully from the virus. She spent on spring day in 1991 outdoor doing yard works. This was not an unusual task for her, but when she awoke the next morning, she felt as if she had moving furniture for 3 days. She thought she had probably just overdone it the day before. Little did she realize that this was only the beginning. The next problem she encountered was a sleep disorder. Although she tried a number of solutions, such as medication, less coffee, warm milk, nothing seems to help. She continued to struggle with erratic sleep pattern for the next 4 years. She also experienced confusion, memory loss, and visual disturbances. Soon, she became aware of joint pain, knots in her shoulders, headache, and sore throat. These symptoms were more apparent in the morning hours, but the sore throat and the mild headache were a constantly problem. She realized something very serious was affecting the quality of her health. When she began walking each morning with stiffness, she knew it was time to seek medical help. At this point, she was getting only 3 to 4 hours of sleep at night, and those few hours were not restful. Her nerves was frayed, and every little noise and action set her off. The medication I gave her enabled her to sleep pattern to change somewhat, but after using the medication for years, she started to develop side effects. This particular medication made her heart race and caused extremely mood swing and horrible nightmare. She was convinced the medication was doing more harm than good, so she decided to stop taking it. It was time for Judy to have a checkup with me. She told me later that she dreaded having to tell me she had threw away the medicine I prescribed and had decided to try vitamin therapy instead. I've always told her that if people ate properly, they could eat all the nutrients the body needs. To her surprise, I had recently become more open-minded, concentrate the effects of antioxidants in the healing process. I even placed her on aggressive nutritional supplement program. In September of 1995, Judy started this program with a nutritional supplement. The effects were amazing. With 3 weeks, she noticed a significant energy surge. No longer did she have to go to bed at 8:30 p.m. in order to make it through the next day, and shortly after feeling more energy, she became aware that painful niggles in her shoulder bleeds has disappeared. By November, the joint and the muscle itch started to subside. In December, she had a minor surgery, and some of the symptoms returned shortly afterward. But she increased her antioxidant intake, and within 2 weeks, the symptoms were no longer a problem. In March 1996, she slept her first 8-hour night. She was delighted to notice her sleeping pattern was once again one of normal deep sleep. Her nerves were no longer frayed, and she felt a perceived sense of wellness and returning. Confusion clearly, and her thinking process began to improve. 6 years later, she's still doing well. The root cause, chronic fatigue and fibromyalgia, are both devastating and disabling disease that the medical community believed to be a different explanation of the same disease. Chronic fatigue patients who have severe fatigue but more sore throats, swollen glands, and fever. Fibromyalgia patients suffering from severe fatigue and total body pain. As I've said, I believe they share a common cause, oxidative stress. No specific treatment exists for either of this disease. As a result, fibromyalgia, usually to be called psychosomatic rheumatism. In fact, many physicians still believe this disease is just in the patient's head. No doubt, these are frustrating illnesses for both the physician and the patient. Unfortunately, traditional medicine offers only symptomatic medication, non-steroid anti-inflammatories, muscle relaxants, antidepressants, and sleeping medication. Physicians also refer the patient to a support group and tell them they just needed to learn to live with it. Let's look at the illness in more detail, see what better treatments are available. Fibromyalgia, chronic fatigue. Near 8 million patients in the US alone may be suffering from fibromyalgia. 8 out of 9 are women. You may wonder, does personality play a role in who might be prone to the disease? Perhaps. Statistics seems to indicate these women are perfectionism who are especially sensitive. These patients are most often living in total pain, are extremely fatigued and suffering from lack of sleep. They wake up stiff, experience mental confusion, and many have irritable bowel and TMJ symptom, which is when an individual develops a very pain jaw along with the headache. Most fibromyalgia patients come into my office toting a stack of medical records from several different doctors. Because a diagnosis of fibromyalgia really takes an average of 7 to 8 years to get. Talking about frustration, there have been tests from top to the bottom with absolutely no abnormal finding. The only way to truly discern whether a patient has fibromyalgia is to do specific tender point testing of 18 predetermined areas. If 11 or more of these areas are significant tender, when only mild pressure is applied, the patient is diagnosed with fibromyalgia. A majority develop fibromyalgia following a serious illness, a major injury, especially of the neck, a substantially stressful time in their lives. As you have learned, almost of this situation greater increased amount of free radical our body produce. Once this disease starts, there seems to be no letting up. One may have an occasionally good day but have little and no reserve. And after doing too much in any given days, including exercising, one may become too stressed or yield, and severe fatigue and will set in for the next 2 to 3 weeks. Treatment: capture the disease. Once I have made a diagnosis of fibromyalgia or chronic fatigue syndrome, I focus on bringing oxidative stress back under control. I can accomplish this best, of course, through cellular nutrition, which I detail in Chapter 17. I also strongly encourage a healthy diet as well as a low-impact exercise program. I always caution against exercising 2 days in a row, recommend combined and mild aerobic exercise program, which a light weight resistance program. Remember, this is a chronic lifelong disease, so rebuild one's health takes time. It's always exciting when a person responds quickly and dramatically, but this is not the typical scenario. I always encourage my patient to commit at least 6 months to improving their condition. They may not necessarily to be where they want to be in that time, but they know they are on the right track. Once my patient begin to see improvements, it is like the lights have just been turned on. Typically skeptical at first, they become excited when there is no doubt that their health is improving. I call this capturing the disease. They are actually bringing oxidative stress back under the control. The first victory a patient notices is the fact that she is no longer experiencing mental fog. It becomes easier to think and centralize on the task at hand. Next, sleeping pattern improve. She can actually get a more restful sleep and see a significant increase in energy. Last thing that usually improves is the pain. That is correct. The pain finally begins to subside. By following this protocol, my fibromyalgia patient have had good to excellent results about 70 to 75% of the time. Several hundred people suffering from fibromyalgia over the past 7 years have improved tremendously following my nutritional program. I've detailed specific on my website located www.nutritionalmedicine.net. I believe that when a patient fails to respond well, it is because we cannot bring her oxidative stress under control via oral supplementation alone. This is when I recommend that my patient to go on medical centralized specialized in IV nutritional supplements. IV therapy is necessary for them to capture their disease and finally begin to improve. Oral therapy then helps manage their condition. Now, keep in mind, these people still have fibromyalgia or chronic fatigue. I am now presenting a cure. Instead, I am empower patients to control their disease rather than having the illness control them. Over the years, I have watched as so many gradually got better. Increasing their reserve, it does take time, but their hope and determined as well reward. Mannery stories. Mannery introduced himself to me in Philadelphia, where I had been speaking. He had drove 200 miles for a chance to talk to me. He shared his story with me that day. It touched my heart. Mannery has suffering with such severe fibromyalgia that he consumed more than 300 Advil tablets a month to control the pain. He had to leave his office, where he had a psychiatric practice, by 3 and 3:30 each day, and was in bed by or before 7 p.m., beginning of overwhelming fatigue. It was at the point she started the nutritional program I had been used all my fibromyalgia patients. With a few weeks, Mannerio began noting a substantial difference. He became more alert. His fatigue began to loosen. He was able to work full day, and he was going to bed later and later. He then began to notice improvement in his pain. After a month or so, his pain improved so remarkable he didn't need to do the Advil at all. Mannerio got his life back. He's again able to maintain a full psychiatric practice and had add 4 to 5 hours back to each of his days. And it has now been several years since I met Mannerio, and he continued to do well. Since his practice often involving treating the mental problem of patients who are suffering from chronic degenerative disease. He certainly have a thought understanding of how this disease can affect a person's life. The growing shift to alternative healthcare should serve as a wake-up call to the medical community. People are becoming more and more frustrated with the healthcare system that their medical insurance covers. So they are frequently resort to self-help method and alternative care for answer, even though they have to foot the pill. Simply put, people are sick and tired of being sick and tired, in spite of the fact that physicians are prescribing antidepressants at record levels. Alternative care is flourishing in the United States around the world. Why? Perhaps patients seek alternative care as a result of experience like scenario I present at the beginning of the chapter. But I also believe has much to do with patients not having the low affair with medication that most physicians believe they do. Patients want an option other than taking more medication. We physicians must realize that we are primarily responsible for the major shift of medical care to alternative healthcare providers. We frustrate our patients into making alternative decisions. After all, the overwhelming majority of patients do see their physician first. Most physicians now appreciate the benefit of healthy diet and moderate exercise program. But the same physicians do so without fully appreciating or understanding the consequence of oxidative stress. If they do, they will strongly encourage their patient to start taking high-quality patent nutritional supplements. Instead of discouraging them, not only would tremendously improving accord in their patient's symptom, doctor would see a significant decline in patients and seeking alternative health care. Thank you so much for listening. Next chapter, I will be reading part 3, Nutritional Medicine. See you next time.